So let's begin with the screening burden. Globally, there are about 285 million people who have the visual impairment due to diabetes. 39 million globally are blind. 15 million blind in India, where we do have insufficient mechanisms for primary eye care, lack of awareness, and about one ophthalmologist for 90,000 people in India. We have a lot of emphasis on the treatment of diabetes, and though we are moving towards direction of screening, the emphasis on the screening is still restricted to very few centers. What are the current models we have? We have the physician-led model, direct ophthalmoscopy, non-mediatric fundus photography, which is again graded by the physician. We have ophthalmologist-led model with screening of the pooled diabetics at one particular diabetic clinic, or teleophthalmology-based models, or we have the hybrid models where fundus cameras at physician clinic take the pictures and the grading is subsequently done by ophthalmologist. What we have been working on along with Singapore and Engineering College Bangalore is to devise a mechanism where we are able to take care of burgeoning load in our country, minimizing the human component into the screening. So we have developed a prototype called Advanced Mobile Automated Eye Screening, which we have named it as MES. That is nothing but a smart eye kiosk for the community. So how does it work? The primary objective is to reduce the gap between the technological advancement and the community need for eye care, with the specific aims of developing a preventive medicine model. So this is a video which is going to show you how this is going to work.
After entering your details, click on the register button to continue. Click on next button. The screening will be guided by audio commands. After entering your details and clicking register button, please place your chin on the chin rest. Kindly make sure your forehead is kept pressed against the headrest until the screening is completed. If you're wearing spectacles, please remove them. You are requested to hold the handlebars provided on either side of this screen. Please follow the audio instructions and avoid moving your eyeballs randomly. Please try not to blink very often. Click on next button. After you position yourself comfortably, the device would move to the IPD position. You are requested to keep looking straight at the red spot. The device will capture the image with a flash to calculate the IPD. Click on next button. After IPD is calculated, the device would move towards you to measure refractive error. An image of a road with hot air balloon will be projected. This image is surrounded by a red ring. Initially, only a small portion of the image would be visible to you. You are requested to keep looking at lower tip of the balloon. Once the device reaches its position, please do not blink and keep focusing on lower tip of the balloon as it starts getting blurred. Click on next button. Once refractive error measurement is completed, the device would move further closer to your eye with a diffused red light projection. You need to keep looking slightly right off the center for a left eye and slightly left off the center for right eye of the red light. The device will capture the image with a flash after the autofocus. Click on next button. After retina imaging is done, the device would move backwards. Once the device reaches its position, you need to keep looking at the red spot. The device will capture the image with a flash after the autofocus. This completes the screening of your left eye. Click on next button. After cornea imaging, the device would now move towards your right eye in an exactly same way as it had done for your left eye. You are requested to follow the audio instructions given during the entire screening process. Click on next. Once the screening of both of your eyes are completed, you may take your chin off the chin rest. You can have a look at a report containing the screening data shown on this screen. You now are all set to experience the fully automated eye screening. Click on Start button.
So this is the kind of the final report that the machine is able to generate. Without any human effort, like an ATM machine, the patient goes, sits there, automatically it will screen for your cornea, refraction, and fundus. So far, this part of the MES, it offers a unique opportunity to facilitate mobile eye care screening and early diagnosis to populations that are at high risk for potentially blinding eye disorders. The general characteristics of the machine are its low cost. It can be used by subjects themselves. It doesn't need a technician or a personnel to take the photographs. It is able to acquire high quality retinal images without the need for dilation and is able to acquire central 45-degree images of the fundus. The advantage, one of them is, of course, it is portable, but it can be used by the patients themselves, which is one of the biggest advantages. We have reached a point where we could get the self-automated kiosk. Now, what do you do with the data? If you transfer the data, you still need somebody to read it. So we are working on the second part of the protocol, which is about application of artificial intelligence to this data that is acquired by the MES to give you finally the report about progression. Now, what is artificial intelligence? Nothing. It's just the theory and development of computer systems which are able to perform tasks that normally require humans. So you keep on teaching the computer over and over again, and over a period of time, it will be able to tell you, for example, if we train the computer to show that would this diabetic retinopathy progress or not progress, you feed the data. So ultimately, you will get an answer when you feed the image that it will progress or it will not progress. AI approach has been used very successfully in diabetic screening with 97.5% sensitivity and 93.4% specificity for detecting referable diabetic retinopathy. So it's a very doable thing which is quite reliable to do. But the challenge with AI is that we normally have to feed the computer about what we are going to look for, and that is how the computer is going to answer. However, there is now a newer paradigm from AI, and this is what we are working on, is rather than teaching a system what we believe are important features of the disease by using the longitudinal data and training the system with clinically relevant outcomes, we can actually learn from the system what features of the disease are actually most important. And that might provide us with newer insights into the disease pathophysiology. So the proposed model, it's just the prototype, very basic thought. I don't know whether we will be successful or not, but at least this is an initial trial. To develop a smart eye kiosk for the community, we are using the prototype right now in Singapore. R&D has been filed, and then into this part we are working right now is integrating the artificial intelligence into the data that is stored in the kiosk so that the machine is able to predict the risk of progression for that particular patient and suggest the further follow-up accordingly, so as to minimize the physician interaction. So here are my acknowledgements with Tan Tock Seng Hospital, Singapore, and BMS College of Engineering, and a grant from Singapore. Thank you very much.